I'm Rebecca Bentley, Principal Research Fellow in Social Epidemiology and ARC Future Fellow, located here at the Centre for Health Equity in the Melbourne School of Population and Global Health. I'm 2 years into a program of research that's examining how our housing in Australia is shaping health inequalities. So I'm interested in how much we spend on housing and where our housing is located, and how the condition of our housing influences our mental health and well-being, but also other aspects of our health. I'm also interested in how it shapes where we live in Australia, in how things like housing costs affect residential mobility and people's access to resources. Most of my research relies on data that's already been collected. I feel like we have so much information already in Australia about people's housing, and we're able to look at that in relation to their health, that a good place to start is what we already have. So we have resources like the Household Income and Labour Force Dynamics in Australia survey, which is a 15-wave longitudinal survey that collects quite detailed information about people's housing costs, and also some good information about people's health, particularly their mental health and well-being. So we're able to use a resource like that to look at groups in the population and what they're paying for their housing. We're able to look at changes over time in terms of what people pay for their housing and how that then impacts on their mental health and well-being. And we're also able to look at subgroups in the population. So for example, we can look at private renters and their housing affordability and see how that relates to certain aspects of their health. The question of whether health and well-being has been part of the way housing policy has been shaped in Australia is quite interesting. So if we think about something like social housing, part of the criteria is people's health. So if people have poor health or complex health, or people that are ageing and also vulnerable economically, they're good candidates for social housing or housing assistance. So implicitly, people's health is part of the way that we provide housing in Australia. But on the other hand, we don't have an explicit conversation about how broader aspects of our housing system shape our health and well-being. So when we're thinking about the consequences for people's health of housing affordability and how we might set taxation around capital gain, for example, we don't really think about the down-the-track consequences for health. And I think that's where our program of research has been quite important, because it's been one of the first to start to sort of unpack that and consider that at the population level in Australia. We know that affordable housing does impact on people's mental health and well-being. And this is a really easy association to look at because there's a fairly direct and immediate in time impact on people's mental health of being in a situation where their housing costs are too high and it's creating stress. We suspect, or we think, that there's possibly other important pathways here as well. So once people's budgets get consumed by their housing costs, it's likely to impact on things like food security and access to education and employment and a range of kind of resources within communities. However, that's a harder pathway to test in terms of what other health consequences we might see from that. So whether housing affordability down the track has an impact on physical health, for example, or cardiovascular disease, it's a really hard association to test. We do know, though, that there's a fairly immediate relationship between moving into a situation where your housing costs are high relative to your income, particularly when you're in a lower to middle income, and particularly when you're in the private rental sector, that has a fairly immediate impact on your mental health on average in the population. In terms of where people live, we don't have evidence that the relationship between housing cost and health outcome is different, but we do know that people's housing costs is a determinant of where people are likely to move to if they do move. So we know that people who are in unaffordable housing, when they make a residential move, they're more likely to move to an area that has fewer resources than someone who moves but isn't moving from a position of being in unaffordable housing or housing stress. When we talk about housing affordability, we're talking about the proportion of income that people spend on their housing costs, whether that be servicing a mortgage or paying private rental, or indeed, paying rental in social housing or public housing sector. When we measure it in our research, we're usually looking for households where they're spending more than 30% of their income on housing costs, and their income is usually in the lower to middle end of the income distribution in Australia. So while that's not a perfect measure of housing affordability stress, it does give us a very good sense of households who are spending more than we would expect them to be spending on housing in Australia. We know that the proportion of people who are spending more than 30% of their income and are in the lower end of the income distribution has been increasing over the last 10 years. We've estimated in our research that single-parent households are 9 times more likely to be in unaffordable housing in Australia. We also know that they're more likely to be female-headed households, and this partly explains why we find a differential between men and women in likelihood of being in housing affordability stress. So gender's a really important part of thinking about how our housing is shaping our health in Australia. In order to address some of the inequalities that we see in relation to housing and health in Australia, we can think about how we provide housing in a holistic way. So apart from conversations that we might have about changing negative gearing in Australia or capital gains tax exemptions, there's also other aspects of our housing system that we should consider. One of them is the provision of social housing. So currently in Australia, about 3% of our housing stock is reserved for social housing. And this is quite different in other settings where social housing is a lot less stigmatised and a lot more normalised in terms of where it sits in the housing system. So in some countries, for example, up to 20% of the housing stock might be reserved for social housing and is much more accessible to people. What this does is it increases the amount of affordable housing that low-income people have access to, and it prevents people from falling into a situation of precarity around their housing, which, of course leads to poor housing outcomes like homelessness. Another important consideration when thinking about how housing impacts on people's health is thinking about the opportunities and resources in their local environments. So in addition to looking at housing, I'm also interested in people's transport access in terms of what's available in their local area, but also around their workplaces and regionally along the transport routes in which they live. So are people able to access employment and education resources in the areas in which they live? And this is important because people often make decisions about where they're going to live based on what they're able to afford in terms of their housing. And they might either explicitly or implicitly be making a sacrifice in terms of what they're able to access in terms of opportunity. So it's important not just to think about the cost of people's housing, but where it's located, what resources they're able to access from that location. And transport's a really important part of that conversation. So increasingly in our research, we're interested in looking at the intersection between housing costs, where it's located, and the opportunities in terms of transport and access to resources that are available in that location. So what we would like to see as a result of our research is a shift in the conversation we have in Australia, away from how poverty leads to people being in poor quality housing or unaffordable housing, to how the housing that we're able to provide can prevent people from falling into vulnerable circumstances or poverty, so that we see housing as a key lever for improving the health outcomes for people in Australia.